Welcome to the EADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights 4 articles in a section called Editor's Picks. Today we explore the Editor's Picks for February 2024. Describing the atopic dermatitis endotype of Inuit children. Do you regret your sunburns as a child? Bloody tears, a rare paediatric case of hemolacria. And skin changes, including xerosis, in a male receiving androgen deprivation therapy. But before we get into that,
abstract submissions for the upcoming EADV symposium taking place from the 16th to the 18th of May are now open. You are invited to submit multiple abstracts and contribute to the extensive scientific program. Don't miss the chance to present your research to a global audience. The deadline to submit abstracts is February the 13th, 2024. See the complete submission process and learn more at eadv.org.
And now, the editor's picks. Article 1. Describing the atopic dermatitis endotype of Inuit children. Atopic dermatitis endotypes differ with ethnicity, relating to a complex interplay between biologic and environmental factors. Information on the unique presentation of AD in the Greenlandic Inuit population is lacking. The Inuit people have been an isolated population with a relatively small homogeneous genetic pool, but with urbanization, their prevalence of AD has augmented. In a case-controlled study by Anderson et al. Among 25 Inuit children with AD, 25 Inuit controls, and 25 Danish children with AD, ethnicity exerted a significant impact on immune biomarkers, skin microbiota, i.e. bacterial composition, and lipid composition of AD skin. For example, type 2 immunity cytokines were significantly higher and S. aureus colonization lower in Inuit children with AD compared to Danish children. The results may be partly explained by the lower level of exposure to Western lifestyle in Greenland, whereas its growing urbanization may be associated with a more atopic endotype. This study highlights the importance of conducting in-depth skin characterization in order to better understand the endotypes of AD patients of different ethnicities and from different environmental settings. Article 2. Do you regret your sunburns as a child? A novel online survey of 17,001 adults was conducted to assess parents' awareness, willingness and efforts to protect their children from overexposure to sun rays according to public health recommendations in all geographical zones and multiple skin phototypes. Among parents with a child under 18 years old, 66% regretted having been overexposed and not having protected themselves enough from sunlight. Their findings highlight that parents who regret excessive sun exposure during their own childhood seem to be more sensitive to preventive measures regarding their children than those who did not express any regrets. Moreover, preventive care measures create somewhat more awareness in subjects who did not express any regrets regarding their own exposure to sun during childhood. This can serve as a reminder to clinicians that education about such measures, including eye protection, remains essential regardless of the patient's personal views in terms of regrets. Article 3. Bloody tears, a rare paediatric case of hemolacria. Idiopathic hemolacria, or spontaneous bleeding from the eyes that is not caused by exercise, medications, or other reasons, is a benign and rare condition that can occur at any age. Although its exact pathophysiology remains poorly understood, it is considered to be secondary to stress and reveals underlying anxiety disorders. It is thought that episodes of emotional distress may lead to hypertension, thereby promoting disruption of blood vessels. However, artificial components as well as serious systemic associations, for example hemophilia, hereditary hemorrhagic telangiectasia, HHT, or other syndromes, need to be ruled out. Saeed Al-Mabrouk and colleagues describe a careful diagnostic procedure after excluding all other potential underlying causes in a 12-year-old girl. See Figure 1. This represents one of reportedly few published cases of this disorder in the pediatric population. It is interesting for dermatologists to be aware of the etiology and presentations of this disease, which may be associated with hematidrosis, epistaxis, hematemesis, and bloody urticaria. Of note, as part of follow-up, the authors recommend that the mental health of children and their families be supported by referring them to psychosomatic consultation. Article 4. Skin changes including xerosis in a male receiving androgen deprivation therapy. The standard treatment for advanced prostate cancer is androgen deprivation therapy, ADT, or drug-induced castration with luteinizing hormone-releasing hormone agonists combined with anti-androgens. Adverse event evaluations in clinical trials using ADT in metastatic prostate cancer do not include skin changes. However, male hypogonadism can be associated with premature chronic and advancing signs of skin aging. As a case report by Zubelis et al. Demonstrates, the introduction of ADT in more robust patients with PSA-only recurrence may be associated with marked premature yet interestingly reversible skin aging, particularly since such patients may experience longer survival and treatment periods. They may face a new and different set of complications than what has previously been reported. The authors conclude that premature skin aging due to ADT treatment should be addressed in the future, both at clinical and basic research levels, including objective measurements and quality of life assessments. To recap, our first article was Ethnic Endotypes in Paediatric Atopic Dermatitis Depend on Immunotype, Lipid Composition and Microbiota of the Skin by Anderson and co-authors. Our second article was Do Regrets of Parents About Sun Exposure Impact Preventive Measures Applied on Their Children by Passeron and co-authors. Our third article was A Young Girl Crying Out Blood, Hemolacria by Saeed El-Mabrouk and co-authors. Our fourth article was Premature Skin Aging Signs Due to Androgen Deprivation Therapy by Zubelis and co-author. Of course, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and though you can find free access and open access articles, EADV members benefit greatly by having access to all articles and content.
Before you go, a quick favor. If you're a regular listener to our podcast, we would love to hear from you. Your feedback will help us improve the show and develop episodes that you're interested in hearing. To participate in the short survey, simply follow the link in the show notes of this episode.
Thank you for your support, it means a lot. We look forward to hearing from you. Until the next episode, take care of your skin.